Okay. So first of all, let me welcome Priyanka. Priyanka, hi. Priyanka is the global head of HR for Integrion, and she's a multilingual HR expert. And she is a VP of HR and a global head for Integrion. And she's a deep interest in mental well-being. And Priyanka, thank you so much. I know it's very busy schedule for you, but thanks for joining in today and share your insights. If you can say hi to everyone.
Thanks, Sanjeev. Thank you so much. It's an honor to be invited to discuss such an important topic. So pleasure's all mine.
All right.
And hello everyone. I'm
Hi, Priyanka.
excited to share my thoughts and inputs today. Hi, Bharti.
And then we have Dr. Shishir. So Dr. Shishir is, hi, Dr. Shishir is very, very accomplished, I would say, well-being expert. So he is the founder of Morphic Minds, and he's based in participated in a lot of international events, seminars. He's spoken across the world, and he is a practicing psychologist, and he has education from one of the best institutes in the world, from Harvard, etc. So very, very honored to Shishir have you here today and hear you.
Thank you, everyone. And I'm privileged to be here, actually.
Hi,
Perfect.
Dr. Shashi.
Hi.
And then we have Augie. Augie, thanks for finally joining in. My friend, how are you?
I'm doing fine. Thank you, Sanjeev.
No, we're lovely
Hi
to have you
all my
here.
panelists. Hey, John E.K. Joseph. What a pleasure to see you.
Yes. So let me introduce Augie before the crowd takes over. So Augie is a dear friend. We worked together in IBM for many, many years. Very closely I worked with him. Is a gentleman, besides being a very accomplished HR professional, and his special interests are in employee relations and labor relations. He is currently the heading employee relations and labor relations for Kyndryl, which is a new offshoot from IBM. This is one business where I used to work. I spent about 10 years in IBM, and Kyndryl is a new company which has been set up. So he takes care of ERLR issues at AP level, Middle East and Africa. So Augie, and he recently got an award. What was that award? You're the greatest innovator in HR. This was from the AP HRM forum, though. And he has interest in HR technology, and you'll find any HR seminar, webinar of worth, you will find Augie there. So he shares his knowledge. So thank you very much. I mean, I can go on, but he's also written a book. Okay, that's great. And Priyanka, thank you very much now with your right picture and your broad smile. So I'm happy that your camera is on. And so last but not least, Bharti. Bharti is a dear friend and a colleague, professional colleague. And she is doing some fantastic work as an NGO that she has founded, Sa Mundra. And she is in a mission of saving lives, very noble cause. So she's into suicide prevention, big way, especially in the youth area. And she's a true professional psychologist and a social worker, all into one. And I can tell you, sometime back, we had posted a program on suicide prevention, and we started getting a lot of calls frantically over the night somehow. People thought it's a call center for, helpline for suicide prevention. And we transferred all the cases to Bharti. She diligently overnight handled all those cases, and she's doing something fantastic. So Bharti, thank you very much for being here and joining the panel.
Absolutely, my pleasure.
All right. So with that, so let's begin. Let me stop sharing I have 1 minute of, things to do. Now, I'll introduce about Enabling World. Most of you would know, but I'll take 1 minute on Enabling World. So this is a boutique HR consulting firm, which jointly is run by me and my friend Sushil. We happen to be classmates as well. So we are into mainly into HR technology, leadership, talent development, HR consulting, and talent search and supply. Our employee well-being is a very important focus. We do a lot of programs for corporates and wellness audit and different things around wellness area for the corporates and for individuals. So this is just a brief introduction about Enabling World. So without taking much more time, just to begin with, as a context setting, I was doing some research, when we this panel discussion, and I was surprised. There are few things that even I did not know, right? And when I started speaking to some people, they said, hey, men's health, is it really an issue? It is not spoken, and especially mental health, people were surprised why we are talking about it. When I started doing bit of research on this, realized things are not as good as it appears to be, right? For example, if you look at the suicide rate, which could be an extreme case of mental illness, in men, it is 3 times, in most of the countries, it is 3 times that of women, right? I mean, many of us may not even know, maybe feeling surprised. Oh, is it really so? 3 times. In India, it is almost the double. And if you look at people who die at work, these are some scary pictures, I mean, scary stories, but I think we should acknowledge the fact why we are talking about it. People who die at work, 95% of them are men. On an average, the age men live 4-5 years lesser than females, right? So there are very various factors, that I started looking into, and we realized, I think it's a serious concern that we should not ignore. We should talk about it. That's the reason we said, men's mental health, unspoken issues, because I don't think it is spoken as much as it deserves. It deserves, right? And it doesn't mean at any point of time that the issue with our other gender is, less, or it is less important. It doesn't mean it is not one over other of, at the cost of other. But yes, I think we cannot ignore men's mental health as well, right? So we have a very interesting panel, carefully chosen, because we have 2 men and 2 women, so that we have a balanced view on the topic. Then we have 2 people from the corporate, Augie and Priyanka, so that we get a view on what's happening in the corporate, and 2 practicing psychologists and counselor and social workers, so that we get a very wholesome view. So we are so honored to get all of you here. So Dr. Shishir, let me begin with you. What do you think you're a practicing psychologist, and you have seen the world, you have handled so many cases, for over the years. What do you think are unique challenges? And we are focused on mental health, right? Which men would have, typically. What are your thoughts on this?
Sanjeev, thank you. First of all, when we talk about what kind of mental health challenges men face, this is a broad question. But if we're talking about what kind of psychiatric disorders are more common in men versus what kind of mental health challenges they face, the answers are slightly different. So if we look at the diagnosis, men are more likely to have alcohol use disorder, substance use disorder. There are specific personality disorders like obsessive compulsive personality disorder, or narcissistic personality disorder, and antisocial personality disorder. These diagnoses are definitely more common in men, and of course, exclusively erectile dysfunction, which is never seen in women. So we have certain diagnoses that are more common in men. However, and as you also mentioned, that the completed rate of suicide is much more than women. However, the total number of attempts of suicides is much more in women, right? But the completed suicides are more common in men. We're going to come to that some other time. But these are the diagnoses that are more common in men. But the challenges are slightly different in terms of, men are less likely to seek professional help than women would. Men are less likely to have buffers in their environment, which would guard them against a psychiatric disorder, or help them recover from a psychological problem if they develop one. So these are some unique challenges, and of course, stigma that we already know, the assumed roles of men, the stereotypes of men. All these could be very unique challenges to men that prevent them from recovering faster.
And in your practice, when you deal with maybe hundreds and thousands of people and you help them, get back to their life, what percentage, of men come to you for seeking help, Dr. Shishir? Approximately, is it same number as women, or very few?
No, I think 50-50
Okay.
men and women come, and majority of my patients, I would say, so I do not represent the whole psychological mental health community. However, if I look at my OPD, majority of my OPD is of young men and women, mostly students who are just graduated, and they have their challenges about the future. But if we look at general OPDs of psychologists and psychiatrists, we would say more women would come for treatment, and for psychiatrists, more men would come for treatment um, because of the kind of disorders they have.
Thanks for that opening knowledge that you've shared, and we'll come back to you again.
Sure.
Augie, if I can come to you, why do you think, I mean, the very fact that International Men's Day is not heard, right? I mean, not by many people, right? And about mental health, again, we don't speak about it. What do you think? I mean, you have in the corporate and in this, I mean, you're very active in the society also. What do you think are the reasons for that?
Sanjeev, thanks for that question. So I think if you take it back, I would say it is some kind of a pressure that comes from the time we were hunters and gatherers living in caves, all right? And therefore, at least to the men I have spoken to, which is very large in number, their insecurities apart from health lie in where their life is leading. Can they be a provider? Because traditionally they've been looked upon as a provider, and therefore can I live up to that expectation? So that fear of failure to live up puts a lot of pressure on men. Okay. The other good thing about it is that they try to do their best, like for example, skill themselves and ensure that they are relevant and so on and so forth. But what I also found that they don't come and ask you for help or advice, all right? And I'll tell you why in my little bit of research is that if you were driving, even now as a male, if I'm driving, I don't ask for directions, though I probably didn't know. It is something the way we are wired, okay? And therefore, I think we need to create a very clear ecosystem, at the workplace. EAP is a great example, right? Now, even the EAP needs to be equipped in terms of how to address those questions. Like Dr. Shishir Palsupure said, they have to go into some of those clear insecurities that a man has. There is career, there is family, and then there is health. Believe me, health comes last in priority, at least to the people I have spoken to. Thank you, Sanjeev.
Great. So I think a great insight and perspective where it originated from. And I think it's time that gradually we change that, isn't it? So Bharti, coming to you, I know you are dealing with youth in particular. I mean, I'm sure, people from all age groups. Wanted to check up, what can we do, as Augie says, that people don't come for help, right? They don't seek help for various historical reasons based on the responsibility that we have entrusted upon them. Oh, you are the provider, you are man up, right? You are the man, come on, right? So those kind of stigma help, remove some of those stigmas and encourage men to come a little more forward for seeking help whenever they need.
Taking this initiative, which is most important. Many people have sent their appreciations for picking this subject. And before going into your question, I think there are also some questions coming here. Why men are hesitant to seek help, or how do we encourage them? I think we have to look into what exactly mental health is. Here, as experts, we all assume that everybody knows. This is another issue because men or people in general have certain misconceptions about mental health per se. They should know mental health is part of general health. It is a state where your emotions, mind, brain are fit and fine. It indicates that you're fit and fine. You're able to think, feel, and act right. You're mentally fit when all this is in place. Mental health can be disturbed due to clinical reasons, non-clinical reasons, like what we say, psychosocial reasons. That's the area that I work. So many of them are talking about, it's too complicated. It is something to do seriously with our brain and dysfunction of brain, mental retardation. The moment we use mental, there is a taboo, there is a stigma, there is hesitation, there is fear, there is withdrawal. So mental health is nothing, we need to make them understand it is controlled by, it could cause due to, chemical deficiencies, maybe these four important chemicals: dopamine, serotonin, endorphins, and oxytocins, or hormonal imbalances, or non-clinical reasons. 69%, the research says 69% of men population in the world is suffering or complaining of suffering this disorder called depression. So we were talking about the percentage. So 69% of in a post-COVID, especially 69%, whether they're employed, unemployed, employable, educated, uneducated, everybody out of the population, 69% is complaining. So non-clinical reasons could be what we pass through, are passing through the Mukha world, what we called all these days. So psychological triggers like grief, stress, disappointment, failure, or unhappiness, basic unhappiness, could also trigger mental health. So I feel it's very important for all of us to know, especially men, to understand that it's nothing wrong in speaking about it, reaching out, and seeking help. I think Augustus said why they don't want to go is because of the way they have been brought up. And in India, the other day also I heard a father, shouting or yelling at his son, "Don't cry like a girl." So you're not supposed to cry. मर्द को दर्द नहीं होता, नहीं होनी चाहिए, तुम मर्द हो. So you're supposed to be in control. You're supposed to keep it yourselves. So men typically, I think, suffer this syndrome called I'm the guy and I'm supposed to be handling everything, handling myself, or not a big issue. That's another syndrome. It's not a big issue. There's nothing wrong with me. It's okay to feel low at times, or it's something that a therapist cannot fix. Or going to therapy means I'm weak. So I'm not weak. I'm strong. So I can manage. And also sometimes they said, oh, self-declared experts will sit there and judge us, so I'm not going to expose myself for somebody to judge me, so why should I pay? That's another issue. And the recent issue, these are the answers that we get from people who approach Samudra, and we have our own way of having a survey. And when we ask them why don't they approach experts, they say it's too personal, others don't need to know about it. Or maybe simple reason like I don't know how to explain, I'm not aware of my feelings, I'm not able aware of putting it in words. And the teenage or the youngsters or the new age, the one big issue new age is suffering is Google can fix it. Google has solution. So a lot of self-medication is also happening. So maybe this is the reason they don't know what mental health is, or they hesitate, or the mindset, it has been driven into their mind that we are supposed to handle it ourselves. I think this is what I feel.
We need to start talking about it and spread awareness that is all right to reach out, right?
Definitely, we need to talk about it, and right from childhood. I mean, of course, now in the national education policy, I'm part of the committee where right from school times, we are talking about mental health, emotions, identifying emotions, and the guidelines for offering guidance to somebody as a first response. So talking about it in school, at home, and workplace. So it's nothing, wrong in talking about it. So as you rightly said, creating awareness everywhere, anytime is the need of time.
And this discussion is a humble attempt, is a small baby step we are taking towards that.
Absolutely, absolutely.
All right. So Priyanka, over to you. I have a very interesting question for you. When we talk about, the gender issues, inclusion, about women, right? We say, hey, men need to be allies and they need to play a responsible part, right? When there's an issue of mental health of men, as we are speaking, what do you think can women do? Both at the corporate, in the family, in the society, what role can women play?
Sure, thanks, Sanjeev. That's definitely an interesting question. On a lighter note, though, I know on most of the times during International Men's Week or Men's Day, women are like, why do we need to do anything for you? You already are so privileged. But this topic on mental health to men, I do agree with so many of our panelists that, men do tend to bottle up a lot. um, a lot of that has got to do with conditioning, a lot of that has got to do with societal role, a lot of that has got to do with their placement in the family, where they are in the apex. They always feel the need to be strong, they always need to position themselves in a way where they are taking care of everything. Even at workplace that happens, and at workplace it gets even more pronounced because a corporate world is mostly a cutthroat competitive world. At any point of time where you have to show your softer edges, people are not comfortable doing that because they are always wanting to do better, always wanting to show their grandiose self. A lot of times, like doctors said that, narcissistic personality show up at work even more pronounced, much more than they would at a family. The family will just, take it in their stride and move, walk off. But we do see men at work having those issues. Obviously, no one talks about it very openly or addresses it openly because sometimes that's looked at as a part of your corporate way of conduct for men. What women can do is, it is important to have that dialogue, is to start normalizing the conversation that it's okay to fail, it's okay to feel low, it's all right to have a bad day, it's fine to lean on someone else, and to find that support system in your family. Obviously your whole family cannot be your support system, but you will have that one person. At work you will have that one friend. First step is talking, which I feel like a lot of men are not okay with. um like Bharti said that across, whether it is cities, rural areas, you name it, people are going through something, especially men. But because the first step of not speaking up and not discussing and not talking out is not crossed, they are not able to go to the rest of the steps. Here, women can play a big role,
Yeah.
ensuring that they even if they are a silent supporter, but show that there are various ways people show love, right? There are gifts, there is behavior, there is touch, various and women can do a lot, especially mothers, wives, sisters. They I think they are the pillars in the family generally, because if it's a South Asian setup, India, you name it, China, Japan, a lot of that has a very, very male dominant society. What happens is women take a back seat. But in such issues, if women start speaking up and showing that support, it gives men that space to be themselves, to show that they also are human beings. It's besides the gender, you need that kind of a environment to thrive in. You
Yeah.
cannot always be the torchbearer, you always cannot be the hunter, you always cannot be the one who gets the bread to the table, and you don't have to be. The world is
True.
changing, the world is evolving. Sometimes it's okay to step down and say that I need to take care of myself. Can someone else help me? And look out for that someone else. So, but some of these steps, while I do feel like it's easy to say that, it's so
Mhm.
much harder to put in practice just because of the way we are wired.
And one related question, Priyanka, very well said actually, and I think we have to go a long way. But during the COVID, I know you are a part of the COVID response team, right, in your corporate at a global level. And COVID has taught us many, many lessons, right? It has changed the lens through which we see the life and the universe. What have you seen COVID has brought? What changes in terms of especially health for mental health for men? Have you seen any changes? Because overall mental health issues have gone up, that we know. But have you seen any particular trend as far as men are concerned? I mean, from your role, and I'll ask that question maybe with to Augie also, because he's doing this again at a very large level.
I think one thing that definitely has been a very well discussed topic throughout this pandemic is mental health, because I think irrespective of genders, one, it was a very, very well discussed and acknowledged issue, at least in big organizations or in any organization for that matter. If you go to see specifically for men, I wouldn't say whether I noticed any mental health specific issues. Were hard to say because I'm not a practitioner. I don't talk about that issues with employees because we have an employee assistance program. But I
Yeah.
did notice that, men started missing that corporate bonding, getting together with friends, or meeting them on Fridays, going out between work, that connection. Because if I can share it with this group, many of them might be from the corporate setup. Is one thing that I've noticed a lot of men do is when they're very very stressed at office, and especially if they smoke, is go down for a smoke break. It's a very very unhealthy practice, but that used to be an outlet. And it's
Mm.
something, although we do reiterate many times that it is not a good habit. It's not something that you should even for alcohol for that matter. But I think men started depending on that in a different way at home. The increase of alcohol intake,
Mhm.
smoking has increased because you are in your own zone and you can just do it as much as you want. It's just put them in a very different lifestyle. And I'm
Yeah.
sure Dr. here will have those such patients who must be talking about this, because I do see there's an increase in, usage of alcohol, usage of smoking, just to feel better. Because sitting at home, you get bored and there are other problems piling up on you. What do? You don't talk generally to people. Uh, then you resort to these things. This is my observation, though, is what I've seen.
Yeah, I'll also ask,
Uh, uh,
yeah, Bharti, please go ahead. One thing I
yeah,
wanted to
yeah,
share was that when I was reading, because there's a lot of pressure on men in general, right? I mean, I'm
yeah,
not saying it's
yeah.
on about the livelihood. I mean, we have heard so many cases where people lost jobs, migrant workers, they had to move from one place to other place. So there was and suddenly very high pressure on keeping the family, running the kitchen, the fire in the kitchen running. And there was a lot of pressure, and that also resulted into some enhanced, issues, mental issues. So Bharti, you were saying something, if you want to add to that, because this is
Yeah,
an
yeah.
important subject.
I'm sure Priyanka really, initiated well about this. But the positive side of COVID, I call it advantage COVID, is that many people, especially men, looked into yoga, walk. I think the number of people who have downloaded or enrolled for fitness classes, they have started recognizing the concept body mind, body and mind
Connection.
concept. Yes, connection and holistic practices have come in. They have moved to organic food and lot of consciousness about self healing, better health, and also in terms of family relationships. Yes, there are, as Priyanka said, alcohol and other addictions increased, but at the same time I have heard many of them telling their family relationships have improvised, their communications with children, and they have started giving time, they have started understanding what a woman goes through at home and how to manage, how does she multitask. They had a lot of time to be at home, and definitely the relationship component has improvised.
Okay, thanks. Augie,
Yes.
I wanted to come back to you as well. What has been your experience? And I think Amit says a very interesting point that, yes, we know the problem, but what can we do about it? So as a corporate, being the head of employee relations, which your primary responsibility is to take care of, lead and guide the organization through these mental health issues. What are some of the things you have done which you see has worked? I mean, that will be good guidance to all of us.
Yeah, thank you, Sanjeev. Some very amazing points that both Priyanka, Bharti have made. The first thing is, what are we doing? Now, we know the problem. We know that the males are hesitant, they have a resistance to come forward and all that, fine. But what are we doing to
Yeah.
address that? Okay. How do we lower the resistance? What is the kind of an ecosystem that we have that embraces people who have these challenges? All right. So I quickly will give you a metaphor. There was this gentleman who had various challenges during the pandemic. Okay. Will my job be there?
Mhm.
For how long will it be there? Would I get fired? If I get fired, who pays my mortgage? Who pays for my children? What about the fees? And all these kind of things. And then he was a teetotaler, and then he saw these big queues outside the bars. I suppose as soon as the lockdown was lifted, he joined one of those lines. bought himself some liquor, and started drowning his sorrows in that liquor day in and day out. Okay. And then when he thought he needed help, he called his company's EAP line. And see, this is where I'm talking about enabling. Okay. So the EAP counselor started speaking to the person and started focusing on his skilling, saying that, look, if your skills are up there, you don't have to worry about your job. But look, that is not his big problem. His big problem is to gain confidence, which he has lost. Okay. So I think we need to first understand that that some part of our workforce out there have lost some level of confidence. And to some of those factors, Priyanka said, they don't have teaming, they don't have their friends, they don't have their buddies, they don't have their smoking companions. Nothing, I'm not calling it out, nothing wrong about it. Okay. These are all social connects that they thrive on. Okay. So once that has been pulled off, then they didn't have an alternate. Okay. Some of them went into the health factor, like Bharti said, and some of them went through the others. But from a corporation standpoint, what is it that we have to do? The first thing is 3 words: duty of care. Every employer has something called a duty of care. And what is that duty of care? Is it to help that employee with an ergonomic chair to work from home, a desk, and UPS and headphones? It goes beyond that. It goes to mental health, all right, to ensure that, okay, is this person open to, let's say, some kind of assessment? Organizations should say, hey, come on, you've been away from the office for, let's say, 18 months. Why don't you do this assessment? Let's come up with, maybe Dr. Shishir can help here and say, let's do this test or assessment to see how equipped are you to handle a situation like this. There you will find the gaps, and then you come up with interventions. But overall, I think there should be a change in our attitude, behavior towards males in terms of expecting them to be the do-alls and all those things. That's not it at all. They can falter, they can fail. You've got to accept that. And also, women out there today earn more than men. Okay, go for that tab in the hotel first. Okay, I'm sorry, some of you would probably be doing that, but I'm saying that, there is this inherent ability in males to go reach out for the tab, do this and that, but create that enabling environment saying that, hey, that's okay, this is on me. That goes a long way to instill confidence. That goes a long way in this person saying that, hey, look, I have a partner here. Okay, so all these small things go a long way in building confidence. And I think the key word here, Sanjeev, for corporates is to enable them, provide an enabling environment, and up their confidence levels. Thank you.
Perfect. Very, very insightful. And Dr. Shishir, I mean, you are an expert in dealing with this. What we research says during this, especially in the COVID time, because of various reasons, the pressure on men, and they're not resorting to the connects, they resorted to a lot of alcoholics and substance abuse. You're an expert on that. One, what have you seen working, where to prevent people or cure people who have gone into this kind of issues? I mean, from your experience, what works?
Not everyone has gotten into mental health issues. However, a lot of people who previously had mental health issues and they were okay, what we call as remission, they have had a relapse. A lot of non-clinical population has had problems like depression, anxiety, and alcohol issues. So we definitely see a surge, a huge surge, and that's gonna be there for quite a long time from now onwards as well. The effect will be very long lasting. What has actually worked with them is definitely, I would say, a combination of psychotherapy, which is counseling, but only evidence-based counseling, which is cognitive behavior therapy, REBT. Such things work. Otherwise, most of the other therapies could be simply, catharsis, which is like you talk out, you went out, but that feels better, you don't get better, and a combination with medication. So I think a combination of these two things has worked. Prevention, we don't talk much. You asked me a question about what work in prevention. We have not talked much about prevention, but corporates is a very good setting where you could actually bring in prevention. And as Augustus already mentioned about about what can be done about these mental health issues with in the corporates is we can start testing, but we can start testing and screening well ahead of time instead of someone having a problem and then testing them. Do you have the ability? But a mass scale testing or screening needs to be done for every single individual, and that will identify the high risk population so that we can intervene very early without threatening their job. A large scale screening would really be helpful.
Hmm.
And one thing more is self disclosure from the bosses. Like, I had depression and I went to this counselor. I called up the EAP line, and this is how I could deal with it. If this is normalized, I think more and more men would come up, and they don't have to talk about it. I think they just have to do something about it. They might start calling the EAP lines if the bosses start disclosing about themselves.
Great. And I think as a general human being, as a, anyone, if we spot someone, friend or brother or someone in neighborhood or fellow colleague, that person is gradually slipping into, these issues, substance abuse or, alcoholism, what can we do? What should be our first thing? Is it recommending him for EAP or counseling him? What should we do?
We should first look at the person who has a disorder, say alcohol use disorder, or we know that they have depression. The person with a psychiatric disorder, they themselves are not responsible for having it, right? But they're responsible for doing something about it. So we need to be, first of all, non-judgmental towards them, that you have a problem and that's a sign of weakness. That would be a very bad judgment. However, you seem to be able to function better, like you can function better, and these skill learning would help you. This is the approach that we might take of problem solving. And either you could self-disclose about yourself, or you could help them guide to a counselor or an EAP line, or you could actually assist them and go with them on this EAP line. But at no cost we are going to say that it's a sign of weakness or you have a problem. We could use the word challenge and skills or skill learning, something on those lines, where we use neutral words, but assist them and follow up, because most men wouldn't want to be given an advice. A gentle, a caring attitude would definitely help if you see a colleague, a friend, or a family member going through a challenge.
Thank you. Bharti, coming back to you, as we say, a few men would seek help, when they need, right? But
Yes.
in your experience, you're dealing with, hundreds and thousands of people that you support, especially youth. Traditionally, where do men go, if they have an issue? Typically, what has been your experience? Do they go to their brother, friend, colleague, manager? Who do they go to? A wife, partner?
It depends. It depends. In traditional family setup, if he's a married person, he would first talk to his wife, definitely. Otherwise, mothers. No matter how old the man is, he would go back to the mother. So mothers have always played that very important role. The first person to whom they confide in. And now, of course, friends. And before friends, it's a virtual world. They choose anonymous online portals. They go express there. They want to play anonymous, without names, without pictures. That's how I think even they approach Samudra, because there's so much confidentiality, and they wouldn't want to express tell us who they are, reveal their identity. So it's always a mother in a traditional setup. In the youth group, it is a friend, especially a girlfriend. And today it's cool to help a boyfriend who's suffering depression. They feel very nice to say that my boyfriend is going through this phase and I helped him out. I took him to a therapist and all this. But yeah, what I want to tell here, the employed lot want to talk to a colleague They wouldn't want to reach out to an employee welfare officer. HR, a big no, because they feel that there is a lot of depravity coming their way, maybe promotions, maybe discriminations, or whatever rightfully they deserve professionally, that would be curtailed. So they wouldn't want to talk to HRs. I think in addition to what Dr. Sishir said, assessment tools and large screening, whatever, but there has to be somebody outside the organization. A third party intervention is required here, because most of the employees who come to us, they say they have not revealed in the workplace. And this is what my observation is.
Priyanka, I wanted to ask you, in your global role, and there is a very strong statement. She said no to HR, right? And I marked that emphasis on no, right? It was very emphatic. So is it real at the workplace that, people are afraid to come to HR or managers, for that matter, to the organizations, people who are responsible, with the fear? And what are we doing? I mean, I'm not asking you doing, but what can we do? Many of us are HR professionals in term, because that's a disservice, right? As a function, if we can't create an environment where people feel comfortable coming to us for help, then it's a bad situation to be into. And Augie, I'll ask this to you as well. Priyanka, your comment.
Sure. So I agree with Bharti. Being an HR professional, so let's take a step back. So what is a workplace? It's another social community. It just makes you make money there. Let's look at it that way. The first conversation you have with the person, okay, you are looking at the individual as another person. Your natural instinct is to form judgments. Now, whether you're an HR, your CEO, whatever you are, and that happens even with managers. Your first instinct, unless you are a professional psychologist or a psychotherapist or a psychiatrist, you are not going to step back and say that, okay, let me look at this clinically and for what this person is coming for. Your natural instinct is to create judgments, to have those first thoughts, and that can subconsciously flare up in other occasions. To her points, it could be promotions, it could be performance management, it could be anything. It's natural to happen. What So let me, when I started my journey at Integrion, interestingly, one of my first projects was, what do I do to create a safe space for employees where they don't have to come to HR to discuss their personal problems, for two reasons. One, to Bharti's point, not everyone feels safe. Therefore, you're not creating an environment where people feel comfortable to come and share. Second, HR professionals are not counselors. And to doctor's point, coming and talking will make you feel great. It's a catharsis. But what is it leading to? What after this? Are we going to do something with this? Are we just going to sit there and listen? Of course, our roles do expect that we are great listeners, but then every problem needs a solution, and just listening and moving on from there is not. So the first step that I took was I brought in a counselor in the organization who used to visit our facility at least once a week. We created an educational campaign at work to tell our employees that there is someone that you can meet week on week basis. This is completely confidential. At no point do we need to know why are you going there, who are you, what are you going for, etc. You directly deal with the counselor. Now that was the first step that we did. The
Yeah.
second thing we did was educate managers. Like doctor said, that your first point of contact is never going to be HR, it's going to be your manager. And your manager will be easy, will find it easy to spot some issues, if not symptoms, and guide you. So training managers is extremely important because they are responsible for the welfare of the team, but we do not expect them to act as experts in these areas because they are not. It's too much of weight to carry. They already have a lot to do, so we enable them by training them, providing them education. How do you refer an employee? What do you do? What are the steps? What are the various ways? Do you email? Do you talk to the counselor directly? Do you call them? Or do you gently nudge the employee to go and seek help? There are various ways. There's no fixed solution to it. So that's what we did, educating our employees that it's okay to ask for help. Actually, that was the campaign's name, that it's okay to ask for help. Second was to educate managers that your employees will have problem. This is not this is not a clinical setup where people will come and do their work and walk away. You will experience emotions, you will experience good days and bad days. How do you handle it and what do you do from there? So we created that space, and then from there what we have done is we have empaneled an employee assistance program that does not sit at our facility anymore because of COVID. So people reach out to the EAP directly. Managers know how to refer. There are regular emails and webinars that we conduct at work specifically for mental health. At no point anyone is forced to attend them. It is obviously by choice and voluntary. And I think the more you talk about it, the more it becomes normal.
Mhm.
If it's a once in a year event, it's just because you did
Absolutely.
that, because you had to do it. It's just a checklist that you follow. But when you do it consciously, people also know that this is a very sincere attempt to 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 resolve issues. There are smaller issues, there are bigger issues, there are so many things that people go through, and no corporation in itself is capable of handling those unless they are doctors in those specific areas. So this is how I feel like, it's important that that safe space is created by HR doesn't need to be that safe space. It's not
Mhm.
possible. I mean, we cannot be self-proclaimed experts, and I don't even feel that it's the right thing to do, because it's very possible that you misguide someone, that someone comes to you with, oh, I had a breakup, what do I do now? So you just hear them out and say, go and talk to your friends. Maybe that person is going through a different turmoil. I don't know what it is, which a
So,
psychotherapist can take care of.
so I'll use one analogy, Priyanka, very well
Sure.
said. We did a program called psychological first aid, right? And the concept of first aid, we may not be doctors, we means managers, us may not be
Yeah.
doctors, but what we all can do is a first aid, listen to the person and direct the person to the right person who could really help depending on the situation. So at least that's a role that absolutely we as HR or managers, we should play. Augie, just a quick comment on what are two things that have worked for you in the organization that you're working to create a safe space where men could feel comfortable coming and talking about their issue, because that seems to be one major issue, how to encourage them to come and share. What are two specific things which have worked? Augie, can you hear me?
I think the first thing, of course, is confidentiality, in the sense that you or your manager or none of us are going. Yes, I can hear you. Can you hear me?
Yes, very well now.
Can you hear me? Okay, great. So the first thing I think Sanjeev here is to knows that whoever he or she's approaching, it says my internet is unstable. Bear with me. Yeah, I lost my train of thought. So here's what it is. So building confidentiality, okay, in the sense that this report or whatever is not going to be shared with anybody apart from your counselor, who's a third-party organization, and they do not have any agreement with us to share those details. They probably tell us 1, 2, 3, 4 people only have come. Beyond that, it's confidential. That is clear. So it builds trust in the system. The second one is, how are you using technology? Okay. Use sentiment analytics to understand, to find out, what kind of sentiment is trending among your workforce. And then maybe you can go and pinpoint what typical workforce you would like to focus on. So sentiment analytics could be a bit far-fetched at this time, but I think it's time to start reading the data, look for that actionable insight and address that problem so that it is more, focused out there. Last but least, you asked me two, I'll give you the third one as a bonus. And that one might sound flippant, okay? But if you're going to say, you have a cigarette packet today that says smoking is injurious to health. If I told you that, taking excessive stress, strain leads to anxiety, panic attack, heart attack, blood pressure, diabetes, etc. on your job, okay? So you are forewarning people of certain things, all right? And this is not in any way telling them, hey, don't do the work. But we are saying, look, if you are not having the right outs for this, which we are able to provide you, you're going to end up here. So sometimes you have to state the consequence. Then you will get the better results. So that's why I'm saying ecosystem is so important, right? So that's technology, that's the lifestyle, and then the ecosystem. Thanks, Sanjay.
Very precise and very useful. This confidentiality in using technology, Augie, very well said. And I think depending on where you are in the journey of digital transformation corporates, right, you can use technology, but confidential is something that we can keep. And Amit made a point here, comment, that they started doing counselor but did not work because people felt they'll be tagged as someone who really needs help on, right? So I think point well taken. Now, Dr. Shishir and Bharti, you as an expert, I want to ask a very specific question. When I was reading through, I found men, especially in the middle age, maybe 34 to 60, around 60, the instances of mental health is extreme, is almost double of the rest of the group, right? What are your views, Bharti, to start with you? What do you think are the reasons that people at this middle age, they suffer maximum from the mental health issue, right? I'm going into the segmentation, of the issue. And then Dr. Shishir, I will ask for your expert comments as well.
Very precisely, it could be personal reasons, professional reasons, or social reasons. And these are the major three reasons. And clinical, non-clinical, I said, sometimes due to chemical issues and sometimes due to emotional issues. These are the major reasons. But the triggers could be, the psychosocial reasons. When I'm talking about disappointments, failures, people are not I think equipped enough to handle disappointments and failures, because it's all very comfortable world that we have been living in today, and unrealistic competitions or unnecessary competitions, extreme expectations, in family or in the workplace or in institutions. We are all not satisfied reaching the target. I think we want to exceed target. We want to be the best. We want to be in race. So these are all, the reasons. Social scientists, it's not me, my observation alone. Social scientists have been saying this, that expectations, competitions, comparisons, disappointments, and having more is another disease today. We are not happy. So I think the simple reason or cause for mental health issue is basically we don't know how to be happy. That's it. If you want to address mental health issue, increase happiness at home, in workplace, in the world, and anywhere. So increasing happiness doesn't happen when it doesn't depend on somebody else. Of course, it is always we. First of all, we have to love our life and be happy, contented, satisfied with whatever we have, and realistic, reasonable expectations, I think, will reduce this big menace of mental health.
Yeah, Dr. Shishir, over to you. Just specifically on this middle age in men, because I've read a little bit about it and found that seems to be the age group where the instance of mental health is very, very high. Any comment from you?
I don't know of such data where the incidence of mental health issues rises in the middle age. However, I have some contradicting data which suggests that your loneliness usually comes down as you grow older. Your happiness generally improves as you grow older, because your resources, you gather more resources, you have more buffers, and you have higher levels of adaptation as you grow up, right? Mm-hmm. However, people who do suffer mental health issues at middle age could be primarily because of physical health issues like arthritis. I even made a meme of it. Like, by the time you get a grab on your life, get a grip on your life, you are gripped by arthritis.
Okay.
So number one, and number two, there could be some neurological issues that start in the later middle age, I would say. But other than that, I think middle-aged men would be reasonably more adapted than the younger counterparts.
Okay, maybe research is still not complete. I anyway read about it, but I think your personal experience is contrary. Bhartiji, we are closing on the closing time. Maybe quick 30-second comment, and then we'll conclude.
I'm done. I think you can give opportunity to other speakers. I've spoken enough. And one point I just wanted to add, in my experience, middle-aged, I think I can be open here. Sexuality issues are, on the rise among middle-aged people. I thought I would avoid, but I have to
No,
tell that.
we are all adults. We
Yes.
can talk about it here.
Yes,
Absolutely.
yes,
So I
yes.
think great discussion. First of all, we are close to the time, and we will, we are respectful of time that people have. So we'll close it at the scheduled time. But I think amazing discussion. I personally learned a lot from all the panelists here and from the audience also. Very interesting question and engaging question that everyone had. But I think I'm taking away a few things. I mean, besides a lot of things that you have said. Augie, that you said a duty of care that everyone should have is something very profound, easy to remember and easy to change our attitude towards, and the role that mothers and managers can play actually. That came out very profound, that the role that mothers and managers can play in the corporate and in the families to take care of the issues that men have. They can create a safe space. And then Augie, the technology and the confidentiality that we can keep, that will help people come forward and talk about the issues, that will take away a lot of issues, are some of the key points. I mean, there's a long list that I've made a note of, but thank you very much. I hope guys, it was helpful to you in terms of busting this myth on the mental health issues for the men. Is it real or it is just a fad? But I think more I hear about it, it's a real issue. And together, men and women together, we can help solve this, right? It cannot be done alone by women or the men, right? So thank you very much. Stay safe, stay healthy, stay happy, and then we'll talk to you all again in the next session. Thank you, everyone.
Thank you so much.
Thank
We
you
learned
so
a lot.
much.
Nice meeting you all here. Thanks a lot.
Same here.
Thanks,
Same here.
Priyanka Bharti,
Thank you.
Dr. and Sanjeev.
Thank
Johnny,
you.
bye-bye, Dr. Shishir, Sanjeev.
Bye-bye.